interruptions look like me getting ahead of them and saying, oh, this is where they're going. And I go there first. And it breaks their rhythm. It breaks the harmony. Interruptions look like me arriving at an assessment. It's really easy to do that, right? And I just sort of have to let that come up. And it can be part of what leads me to the next place. But if I attach myself to it, I've already interrupted the flow.
I'm Michael Max, and this is Geological. Chinese medicine is personalized medicine, and this is one of its greatest strengths, that we see each person as a unique individual and treat accordingly. I've always found it a bit funny that our hyper-individualized Western culture has created a medicine that is one size fits all, while the more collectively oriented Chinese culture has created a medicine that's based on the individual. Perhaps this is just another expression of yin-yang to remind us that opposites are also complementary, and beyond the apparent polarities, there's a vibrant, complex unity. But beyond our medicine being personalized for the patient, it's also personal for the practitioner. The basic principles of all methods of Chinese medicine and acupuncture are rooted in fundamentals that we all share. And these fundamental roots give rise to the stunning variety of approaches that help us to help our patients. Chinese medicine isn't just personalized for the patient. We, as practitioners, can bring our own unique constellation of interest, perspective, inquiry, and quirk to this endeavor. Chinese medicine doesn't ask us to be different from who we are or our inquiries of how we want to be in the world. We get to bring our own unique wobble to the rodeo, and through practice, discover who we are, what unique talents, quirks, and questions are ours to discover and use within the framework of the 5 phases, climactic qi, dances of excess and deficiency, that all arise from the great tidal flows of yin and yang. Our medicine has room for our unique personage. It's spacious enough to allow us to explore the edges of possibility that's ours to glimpse. Not only don't we need to conform to some outside standard, but knowing more of who we are and how we work makes us more uniquely effective practitioners. The practice of Chinese medicine not only allows us to use the time-proven perspectives that have wound their way down to us, it also invokes the unique responsibility we are each called on to add our own perspective. It's not just a flame that has come down over time. It's a responsibility to take what we've been given, add our own authentic voice, perspective, and method. It's not enough that we take what's been given. It's a part of the responsibility to add our own unique expression, the one that only you can add, and release it into the stream of time. These conversations come to you through the generous support of our sponsors and members. Blue Poppy, your new one-stop shop, has speedy shipping options on everything that you need for your clinic. It's Women's Health Month at Mayway Herbs. Check out their new website for learning resources on helping women with herbal medicine. Are you a creature of habit? How about making a change that helps your patients and the planet with AccuFast needles? And later in the show, raising your fees doesn't have to be a difficult process. Jane has helpful suggestions on making it easy and effective. And finally, have you considered that having a thriving, profitable practice is one of the most healing things that you can do? Julie Bear Don't Walk has, and she can help you do something about it too. Do be sure to visit the sponsors page on the Geological website to take advantage of all the special offers our terrific sponsors have for listeners of the podcast. Picture this. Your clinic is buzzing with patients, and then you realize that you're down to your last box of needles. No need for panic, because Blue Poppy, your one-stop shop for all your acupuncture needs, they ship orders received before 3 p.m. on the same day. With a quick visit to Blue Poppy's website, you can order premium needles, herbal formulas, and that special Dr. Bob's oil that your patients love. Blue Poppy understands practitioners can't keep patients waiting. That's why they strive to get you what you need when you need it. From high-quality Chinese herbs and formulations to acupuncture supplies and clinical essentials, Blue Poppy has served practitioners for nearly 40 years with products that meet the highest of standards. Discover everything Blue Poppy has to offer by visiting www.bluepoppy.com, and don't forget to subscribe to their mailing list for exclusive offers and more.
Hi folks, I'm Yvonne Lau, president of Mayway Herbs. May is Women's Health Month, and as a women-owned and women-run business, we especially love how Chinese medicine can support wellness through every stage of a woman's life. So in this month's newsletter and podcast, we're covering topics like PMS, pregnancy, menopause, and osteoporosis. We'll share expert insights and effective treatment strategies you can put to good use in your clinic. Our Plumflower brand line includes herbal tea pills, tablets, extract granules, and organic herbs, all of which you can find on Mayway.com, and where you can also find articles, videos, and other resources to support your practice. Since 1969, Mayway has been a trusted source for high-quality herbal products. In these challenging times, please know that we remain committed to keeping our products accessible and affordable so you can take care of yourself and your patients. As always, thank you for supporting Real Chinese Medicine.
Daily habits and routines feel comforting, familiar, easy, automatic. That's the power of repetition. You've worked out the kinks and can do it with your eyes closed. But what if you shook things up? What if you ditched the old routine and tried something new? Hi, I'm John Sten. I've practiced acupuncture for over 30 years, and together with my wife Kelly, we created the world's first eco-friendly acupuncture needle. The AcuFast earth-friendly needle system cuts your packaging waste by 60 to 90%, depending upon your needle type, speeds up your needling, gives you more control, and best of all, while you're healing patients, we plant a tree for every 2 boxes your clinic uses. Thousands of acupuncturists have already made the switch. In just the last year, they've helped plant over 16,000 trees. Since we started, that number has grown to over 50,000. So break the routine. Be the change. Visit acufastneedles.com. Your patients and the planet will thank you.
I grew up as a third generation of immigrant ancestors. Our family had enough stability in the 60s and 70s to allow for, demand really, that us kids not do the work of our parents or grandparents, but ratchet up to something like a doctor or a lawyer. I never wanted anything to do with medicine, right up until I started to get curious about acupuncture and how it seemed to have the capacity to pivot me into a whole other aspect of being with just a few needles. Acupuncture changed how I thought about medicine. It still does, all the time. I used to think that medicine was something that was done to us or we did it to other people. It's inherent in the tacit agreement between patients and doctors that doctors are going to, air quotes here, do something to fix the patient. In this conversation, that is a part of the series on bodywork and East Asian medicine, we explore the medicine not of doing, but of being with. Karen Elisa is a practitioner here in St. Louis. We enjoy occasional walks through the botanical garden here and noodle on our practices, what we're discovering, puzzled by, and curious about. While us acupuncturists like to remind our patients that acupuncture is a part of East Asian medicine, not the entirety still, for the most part, our work comes down to using needles. Karen is a hands-on practitioner, deeply steeped in the principles of our medicine, and has another perspective that fits East Asian medicine hand in glove. And yet, let's listen in and find out. Karen Elisa, welcome to Qiological.
Thank you, Michael.
I am delighted to have you here. You are a very hands-on practitioner.
Very much so, yeah.
In St. Louis, Missouri.
Yeah.
So we're neighbors.
Yes.
And we hang out from time to time. We go on walks through the incredible botanical garden here in St. Louis. All y'alls, if you ever get a chance to come to St. Louis, Missouri Botanical Garden is exquisite. Karen and I have been walking through the gardens and having conversations about medicine and things for years now. So I'm so happy to have you here on Geological, and we're going to take a walk through our metaphorical garden.
Thank you for having me.
Yeah, it's my pleasure. So you're not an acupuncturist. You are very much an East Asian medicine. I'm not even sure what to call you. I know that you work incredibly deeply with your hands. I guess we could call you a body worker. You're here in this body work series that we're doing. We talk a lot about channels and we talk a lot about Chinese medicine. You do this other thing, Ortho-Bionomy.
Yes.
Which, in my experience, is a lot like the very soft yin types of body work that show up in Chinese medicine. I'd like to get your take on it.
Yeah, I've been working on my take on it since 1994. So what you could call me is an Asian bodywork therapist, or at least that's what the American Organization for Bodywork Therapies of Asia established as our title in the United States, a shiatsu therapist. That's how I started. And then I, in the middle of what I thought was a nice clean trajectory, I encountered Ortho-Bionomy in the person of my teacher and mentor, Terry Lee. And it changed. It didn't really change the trajectory. I'm still an Asian bodywork therapist, but it interwove. And then I used to say it was like kudzu. You know what kudzu is?
Oh,
right?
yeah.
Yeah. So wonderful, powerful plant.
Wonderful, powerful, viney, and intertwines with anything it comes in contact with.
And transforms it.
Wow. Okay, there's the essence of our work in a way, isn't it?
Yes, it is the essence of a lot of our work. And when I encountered Ortho-Bionomy, it simply shifted the way I approached my shiatsu, and it sent me looking for teachers in shiatsu that resonated with what had called to me in Ortho-Bionomy. So it's really plotted my course to a large degree. What I was drawn to in Ortho-Bionomy, yes, I've seen a lot of similarity to, say, for instance, Sotai. And then, of course, when I discovered Alice Wheeldon and Seiki, it was like, aha, that's another piece. And I sometimes tease my Ortho-Bionomy colleagues that they're actually practicing Asian bodywork. They just don't know it. Because part of Arthur Lincoln Paul's influence, Arthur Lincoln Paul's being the osteopath who developed Ortho-Bionomy, a huge part of his influence was that he was a judo practitioner. So he comes to, fairly high level judo practitioner, and all those concepts. I mean, there's so much interplay between the martial arts and body work anyway to begin with. So all those concepts, he brought to osteopathy.
And to the Ortho-Bionomy.
And to Ortho-Bionomy, yeah.
What are some of the core concepts? Because I suspect it's going to rhyme with a lot of what our listeners are already playing with. But I'd like to know.
Yeah, absolutely. And I often encounter this because, I'll articulate some of the concepts and people will say, well, yeah, that makes perfect sense. I mean, that makes sense to me already. And I'll say, yes, and. There's another level to it that in spite of the fact that I've been very interested in osteopathic principles as well, and consequently have studied with Burrell Institute, and I've also studied with the Upledger Institute, just because this fascinates me, this approach. But there's like an extra piece to this, and it's almost like, yes, I know that looks obvious, but there's a deeper level to this that I think is pretty unique to Ortho-Bionomy. I don't know if you would get it if you took, a weekend class in Ortho-Bionomy. I think you have to sit with the practice for a bit longer to pick that up.
As with so many practices.
Yes, absolutely. And of course, very often when you sit with a practice long enough, other practices you begin to see the resonant line between them. So, I'm trying to figure out how to explain this. So, to get back to your question, principles, because ortho-bionomy is a principle-based practice. Terry Lee likes to say that if you understand the principles and you're applying the principles, the technique follows. So you can learn some of the techniques, but it's really the principles that guide it. And if the technique, you can't figure out how to apply the technique and also apply the principles take precedence. The most important principle, no, I can't even really say that. All of them are important, but the most important principle to me very often is non-judgmental presence. And that, again, sounds pretty simple on the surface, but it's very, very difficult. And it's one of the things that I'll be practicing for the rest of my life. Non-judgmental presence, less is more. And I'm going to blank on this, of course. You exaggerate the pattern that you find, but only slightly. It's more like a reflecting back of what you're hearing in the body, just loud enough that if the body has learned to ignore its pattern, it recognizes it again. Yeah.
Mm-hmm.
So rather than listing off the principles, I think we could probably discuss those few, and it might lead to more if you like.
Absolutely. There's a lot here.
Yeah.
In my mind, I first want to talk about this non-judgmental, say that again?
Non-judgmental presence.
Non-judgmental presence. We're going to get in, I just want to stick a pin in it for now.
Sure.
Because the last thing that I heard was you take a movement, you exaggerate it just a little, just enough so that the body hears itself.
Yes.
And I think about how often we do this with words. I'm fascinated by language. I wish I could use my hands better. I tend to use language more than my hands, and I think that's one of the reasons why I'm so fascinated with the hands-on medicines, because it's an area that I feel like needs development for me, and so my attention gets drawn there a lot. But coming back to language, there are ways of using language with just a little nudge of language. You bring up what's present for somebody that they're not hearing. I think one of the best ways that I've heard it described was in the book, and also the audio book, Never Split the Difference by Chris Voss, FBI hostage negotiator. This like New York guy who's like a pussycat when he talks to people. And when he's talking to, really bad guys, he's looking to be as empathetic as possible. So he's looking to reach and touch at the empathetic level with people. And he'll speak very softly to the thing that's present but not spoken. And it connects him to like bank robbers and hostage takers in ways that magic things evolve. It's a beautiful way to use language. Often in clinic, somebody will say something and I'll feel something of a resonance in me with the last words that they said. It's like, oh, I heard that, but I don't think they did. It's that moment. It's not take any last words somebody said. It's the last words that I go, oh, but they failed to notice. And I just speak them back as a question.
Yeah. I find the work that Nick Pohl is doing with clean language also to be really fascinating because it has that nature to it. I would go so far as to take the judgment out of even that.
So yeah, talk to me more about that. I watch my mind judge and discern all the time.
Mm-hmm.
I would like to hear your sense of the difference between judgment and discernment, and also how we take the judgment out and then what's left.
Yeah, this is when we're using language, it gets difficult, doesn't it? Because judgment and discernment. So to get to what I was saying, the judgment in that I heard that, but they didn't. I would even leave that latter part out. And why is that important? There's a poem by D.H. Lawrence, not I, but the wind that blows through me. A fine, fine wind is blowing through time. And it's one of my favorite poems. And one of the things he said, I'm going to misquote, but I would blur no expression to the degree that I insert myself. I mean, obviously I'm here as a witness, but to the degree that I insert myself and my judgment, spoil no expression, I actually blur what I'm trying to hear from the person. It doesn't really matter whether they noticed it or not. What matters is that I'm here with them now noticing. Does that make sense?
Yes, and.
Okay.
And I can see how Nick's work would draw you, because that is such a meditation and process of not me, not my bright idea, not my judgment, not my perception, but more, what is it for this person and what else is there? And that, and yes, that, and what else? And yes, that, and what else is there? And so we're getting yes, language is tricky, but it's what we have to work with here. So, we'll play with it, and language is playful.
Yes.
So we have that going for us.
So discernment,
and yeah, let's do discernment, and then we'll come back to my question.
Yeah, because discernment is what I'm using when I'm sitting with the client, and I discern a pattern to which I respond. And then, of course, it's always possible I'm wrong. So that's also important. You have to be really, really comfortable with being wrong.
We actually get lots of practice.
Yes, we do. Absolutely. But there's a constant checking in with the client. It's not necessarily verbal. It's a call and response. This work is a call and response. And I had a client actually say this to me the other day. She said, it's like you're calling to these different parts of my body and they're waking up and saying, yes, I'm here. And she said, it's also like taking a walk through the Grand Canyon, only it's my body and I am the terrain and I'm exploring it. That's a good session. That's a good session. And if I am not careful to blur no whisper or spoil no expression, they don't get that. I have to walk so lightly so that the experience is theirs.
Yes. So often, I think for acupuncturists in particular, again, one of the reasons I love talking to people that work with their hands, there's a sensitivity that I think many of us acupuncturists don't have, because we're there by gum to do something. We have some pretty powerful tools to do it with as well.
Yes.
And we have this idea that we're the one who's doing something.
Yes.
And can you help people that way? Yes, you can. Can you also miss things that might be helpful or overlook the quiet aspects that are just waiting to be noticed? We can run roughshod right over them.
Yeah, you can accidentally end up being a bull in the china shop.
We can be a bull in a china shop. Absolutely.
So my initial training, I'm a practitioner of integrative eclectic shiatsu. And so my first teacher was certified in integrative eclectic, which incorporates a number of, we're taught to do moxibustion, we're taught to use magnets, we're taught to do auriculotherapy, we're taught to do cupping, and dietary therapy, those kinds of things that go with it, in addition to incorporating some Western medical massage, neuromuscular therapy, and things like that. So I was well equipped to decide Also, my first teacher at the school was a 5-element practitioner, studied under Cindy Banker at the New England Shiatsu Center. And so, I got Worsley, which completely messed me up on my point counts forever. So it will always be bladder 54 to me. And, so we learned to do a thorough assessment and, figure out what's in balance and what's out of balance and put together a treatment and then go in there, right? I wasn't comfortable with some of what I experienced because, as part of learning, I'm sure that this is normal, but I'm more than a little bit. If I want to study something, I want to receive the work and I want to receive it a lot because I really want to feel what it feels like. So I was getting regular work and feeling what it felt like in my body. And sometimes it just felt like a real imposition. That's not to say good things didn't happen. I did. I mean, I have a huge respect for that body of work. But for me, and it's often true, that how we prefer work influences how we go on to practice.
This episode is brought to you by Jane, the clinic management software that honestly just makes running a practice easier. Let's dive into something that's never easy, but sometimes necessary: raising your fees. It can feel awkward, right? But here's a tip that can really help. Consider offering flexibility to your patients as you introduce the change. When patients face new fees, it's natural for them to feel uncertain or concerned. That's where flexibility can really make a difference. Offering options like a phased increase, suggesting a payment plan, or even taking a moment to talk things through can help to ease the transition. These thoughtful gestures show your patients that you're listening and care about them, which strengthens the trust you've worked so hard to build. If you're looking for more ideas on how to navigate these kinds of changes, head to frontdesk.jane.app and check out the article, How to Tell Clients You're Raising Your Fees. One last thing, if you're ready to give Jane a try, you can use the code CHIOLOGICAL for a 1-month grace period on your new Jane account. Oh, absolutely. We talk about Chinese medicine, East Asian medicine as being a personalized medicine, meaning we personalize it to the patient.
Yes.
The other side of that is it's an opportunity for us to practice the kind of medicine that's ours to practice. It's personalized to the practitioner as well.
Absolutely.
Yeah.
Absolutely. I found that I was I just wanted to be gentler and gentler, not even in the way that I contacted a point, but gentler in the way that I engaged the client. And then I met Terry Lee. And what got me, actually, I got my arm twisted to go. I figured shiatsu was it, and traditional Asian medicine, and that was going to be me for the rest of my life. But somebody kept bugging me, and so I actually just kind of stuck my head in. The demonstration was in a room like we're in right now, and I basically just kind of stuck my head in the door so I could tell this person who had been bugging the heck out of me that I had gone. And I see this woman practicing, and the first thing she said that really got me to put my foot past the threshold was, this is how you release the iliopsoas without touching the iliopsoas. Because the number one thing that I hated to have released was an iliopsoas. I hated having iliopsoas releases. I always felt like I had to recover a couple of days afterwards, not just for the physical ramifications, but also the emotional. She had me at that point, but I was still a little skeptical. I walked into the room. She invited someone else to get up on the table, and I thought that was the best way for me to find out. I climbed on the table, and I had a long-standing kink in the neck that, would go and then come back again, go and come back again. It was pretty stubborn. And so I asked her to work on that. She just started waving my arm around in the air. I was like, what is this woman doing? And she keeps talking while she's doing it. I was like, she's not even paying attention. What is this person doing? She's waving my arm in the air and she's not even paying attention. And then I got off the table and there was no pain, no residue whatsoever. I was like, okay, I have to see what you're doing. And I started studying with her. Another thing that I had found very difficult as I progressed in my studies was this idea that the practitioner would tell you what you are, what your imbalance is, or just be standing there and saying, well, I get that this and this and this is happening. One of the things that Terry said to me was actually to the class. She said, just because you hear it doesn't mean you say it. Just because you hear it doesn't mean you say it. And the other thing she said that I just loved, and that was she had me after that, was you don't go dinking in the grand woo-woo.
You don't go dinking in the grand woo-woo.
You don't go dinking in the grand woo-woo. Just because you can perceive it, and as we practice, we get very good at perceiving things, doesn't give you the right to go mess with it. Just because you perceive it doesn't give you the right to blurt it out and, lay that pattern on top of whatever other pattern that person is working with.
So one of the wonderful things about doing this series on bodywork, I've heard more than one person now say, don't lay your concept on your patient.
Yes, absolutely. It's almost like surgery. And mind you, there are times when surgery is necessary. But why do surgery when an herb will work? Why? It makes no sense. Why do you want to go in with a scalpel when, you could simply sit there with a person and they would come to their own conclusion?
I love that. Allowing a person to come to their own conclusion. So, as I've studied some of the quieter body works, because again, my hands are not that linghua, they're not that lively, not as lively as my mind, and it's an imbalance that I notice in my practice, and so I spend time on my imbalance, working on my hands. And so I've also studied some cranial, I've studied some other kinds of things, and you hear people tell these amazing stories about, like at the age of 3, they had this experience with their parent, and they decided they were this kind of a person, and blah, blah, blah. And you hear these stories of people having these perceptions, getting that, and then, okay, I'm going to do something with it, and they do something with it. And there's a part of me that's like, ooh, man, I'd love to be that kind of magician. That'd be cool. However, when I have at times been quiet enough, discerning, or whatever it is, it's hard to put into language. I have at times had glimpses of people at earlier, very profoundly influential moments in their life. I am reticent to look at it too closely. I am reticent to speak it. It's that it's present. Yes, it doesn't give me permission to take that and do something with it. In fact, as far as I can tell at this point, I don't have a ton of experience with it, but I've had enough experience with it to know, caution, don't look too closely. Use your peripheral vision. Attend, don't push.
Yes, and that is the point where judgment is like too much weight on the hand.
Mm-hmm.
You're walking through people's gardens and you want to walk gently. You don't want to bruise the leaves as you go through.
Walking through people's gardens.
Yeah.
Yeah. I just have a shiver that goes all the way through my spine. One of the things I love about practicing medicine is taking something like walking through people's gardens, just taking that into clinic with me and seeing what shows up.
So, there are times when I might invite someone to use a more forceful form of body work, or even, there is acupuncture and then there's acupuncture. And there are sessions where it almost feels like ortho-bionomy, in that, just the right nudge has been here and just the right nudge has been there. And then I unwind. And sometimes it feels like, this person just came in and kind of rearranged the furniture for me. There have been times when I really needed the furniture rearranged. I'm not saying that there's not a place for that, but I am more comfortable with that walking lightly and allowing the person to come to their own awareness. And I don't even decide what they need to become aware of. That's important. Another thing that Terry often says, if somebody comes in with a physical deformity, say for instance, they have scoliosis. And by the way, I've seen some pretty amazing results with Ortho-Bionomy principles applied to scoliosis. But we never make the assumption that that's what's going to happen, nor do we promise that that's what's going to happen. That's important as well, because it gets back into judgment.
Yes, and we never know what's going to happen.
Yes.
Nor do we even know what the patient actually needs.
Right, but they do. On some level, they do.
Agreed.
But she said, my job is not to make that scoliosis go away. My job is to make them more comfortable. And in the process, or help them be more comfortable, let's take make even out of that. In the process of them becoming more comfortable, it's possible that scoliosis will shift. But that's not what I'm there for. That's, as we used to say, or we still say in New Orleans, lagniappe. It's lagniappe. A little something extra. Yeah. The shift is a little something extra. What we are doing is helping people find comfort in their own bodies. And that's huge. It's really huge because, at least judging by what I see when I walk out the door, most people aren't comfortable in their own bodies. It's a terrible breakdown in communication, in my opinion.
And reinforced at so many different levels, from advertising to family stories to, just so many ways.
Yes. Yeah, we do disconnection really well.
We do disconnection pretty well.
Yeah.
I'm thinking about, I was just talking about those rare occasions where sometimes I'll get a glimpse of something. And I don't want to muck with that. It's been curious to me how the quiet observation on my part, respectful as possible, not asking anything else to happen. Sometimes people will go into the story just spontaneously. I am not asking or inviting anything. I'm simply present with something that seems to be present. And they'll go into some story about it and move through it. So not always. Sometimes they just stay in it and they're just like stuck. But sometimes they'll move through it, or they'll speak it harshly and then their voice gets softer. There's all kinds of things that can happen in that moment. And it's not even a light touch. It's something else. I don't even know how to put words to that.
Yeah, it is hard to put words to that. Which brings up, when you were talking, I was thinking of, another principle, which is non-attachment to results.
Mm-hmm.
I'm really upfront with my clients about these principles, by the way. I'm not attached to results. When you come in, we're just going to work and we're going to see what happens. And the worst thing will happen is that nothing will happen.
You don't worry about making things worse? Having things get worse?
Because I'm not forcing anything.
Yeah. If we force things, there's more chance to run in amok. Yeah, okay, fair enough. That's a really brave thing to do, Karen, because usually the tacit agreement in our society is people come in for us to fix something. We're going to do something. They're going to get something.
People come in for me not to fix them. Yeah.
People come in for you not to fix them.
And I'm, like I said, if they're coming in and they think they're there for me to fix them, right up front, I make that clear. I am there to support them, to witness, to reflect. I'm not even sure I like the word fix. Because fix imply, you talk about something being fixed in space. And we're not like that. We're not fixed at any moment in our lives. We're constantly expanding and contracting. And at the point that we become fixed, that's actually when we have a problem.
Okay, so this is where language gets to be really fun.
Yes.
People come into it's like, I want to get fixed.
Yes.
Well, actually, our job is to unfix people. We're there to unstick them, unfix them,
Yeah.
help them expand, breathe more deeply,
Yeah.
be more congruent, be more fluid. We are actually unfixing people.
Yeah. Yes, except that I'm just waiting to see what they decide. So, Ortho-Bionomy is, if you are applying the principles, and it's really easy to get sidetracked from those principles. There are all kinds of, as you mentioned, societal forces encouraging, including market forces, encouraging us to veer off that path. But to the degree that I keep those principles in my clinic, really interesting things happen. Really interesting things happen. And, they're more than I could ever plan for.
I think a lot of us have this idea, I know I'm one of them, that the wisdom that the patient needs is within them. The healing that they need is within them. And at a certain level, I believe it. And at a certain level, I don't. Constantly second guessing that. It's like there's a part of me that's like, yes, that's true. And at the same time, to really get at that, I have to take myself out of what's going on there more and more and more and more. Not that I'm not paying attention. Not that I'm not attending. That's not what I'm talking about. What I'm talking about is taking that part of me that likes to pat myself on the back and say, good job, Mr. Max. Well done. I don't really get to do that with this kind of work other than really maybe just a quiet moment of recognition that I managed to keep myself out of that laying a concept on my patient.
Yes, that's true. But there's a kind of, how shall I say this? There's a kind of contraction in that, mind you, I really like patting myself on the back as much as the next person. Absolutely. But there's a contraction in that. It's almost like when I talk to people about Tai Chi, I say, you don't want to contract the joint. Chi can't flow. There's this contraction about that I that keeps the chi from flowing. So what you get in exchange, in my experience, or at least what I get in exchange, is just the same experience you get when you sit on the side of a creek and watch the water go by. You know how incredibly calming and relaxing and joy-creating that is when I succeed in practicing this way. That's how I feel at the end of the day. I don't even want to get in the way of that. It's more rewarding. It really is, in the long run. Trusting the process. That's another thing. The more that I interfere, we're getting into kind of a paradox here, because I actually had this conversation with grandmother Winter Jade. It's possible that this work works so well for me, in part because I'm a very, I'm trying to come up with the right word for this. I'm a very forceful person by nature. I tend to occupy my space. I always did. My kindergarten teacher was always calling me down for this. I wasn't a bully, but I was so sure of myself that I just kind of, I ended up kind of overwhelming the other kids sometimes. And it might be that because I already have that in my personality, when I back off, I'm still present enough. Some people, if they backed off, might not be present enough.
Again, this is something I work with.
Yeah.
Backing off is not the same as not being attentive. Backing off is not the same thing as not being present. You can back off and think about what you're having for dinner, and yeah, there's plenty of room because you're not even there.
Yeah.
I think what we're talking about here is a kind of cultivation that comes with time and attention and practice of being present, completely unattached to results, full of curiosity at what is happening now. Not even what's going to happen next, what's happening now.
Yes, and yet you are entirely present. Your presence is required.
Having a thriving, profitable practice is one of the most healing things you can do as a healthcare practitioner. Because a robust business is the ultimate expression of vital chi. And that's the heart of our medicine. I'm Julie Bairdontlock, and I help practitioners grow nourishing, profitable, authentic businesses that embody the generative cycle of Chinese medicine. This isn't about all yang all the time. It's about expanding your own internal capacity, growing collaborative relationships with your patients for ethical patient retention, and marketing as an extension of this medicine, not a necessary evil. You already know that everything is connected in your patients' lives and bodies. The same is true for your business. When we align your systems, your schedule, your pricing, and your offerings with you, we create flow, which means more spaciousness, more impact, and more joy. When you are in the flow, fully resourced in terms of chi, time, and money, your business becomes a source of healing, not just for your patients, but for you. Let's grow something rooted, radiant, and real. Visit lifeflowconsulting.com to learn more.
Presence is required. I want to come back to this word, this idea of fixing.
Yeah.
I'm so intrigued by it because I've got a whole new view of it now from having had this much of conversation with you. I do look at my practice, especially over the years. I think about how I've been with patients. Yeah, people often want to have something nailed down. They want it fixed. They want it nailed down. They want it taken care of. I feel as a practitioner, it's my job to deliver that. I am very much in awe and curious to see what would happen if I adopted more of an attitude and a perspective like yours, speaking it out at the beginning of the relationship with the patient that we're not here to fix anything. Holy smokes. Would I have a business? Curious.
It would be a different business.
It would be a different business. Yeah. And that I would be a lot less tired at the end of the day. You know, and I've mentioned this before on the podcast, back when COVID first struck, March 2020, like everybody, I closed my practice down. And after about 2 weeks of not working, I had this incredible whole body, whole spirit sense of being unburdened. And it was so curious to me because I love my work and I feel like it's a great privilege to get to do the work that I do. And I didn't realize that I was carrying burden at such a significant level. And it's been helpful to recognize that. I think it was a shadow aspect of practice for me that didn't have a voice at my table. It has a voice at my table now. And it does have me doing things like not overworking myself. It has me saying no to patients that say, can I come in at 6 o'clock? It's like, no, I got dinner with my family. And so I've learned to shift in ways that I feel less burdened. But when I'm honest with myself, in this moment here with you, yeah, there's still some burden that goes with it. And I'm wondering how much of that burden comes from feeling like I'm supposed to do something that makes my patients happy in the way that they think they're going to get happy.
That's a good question to ask. I still feel that I have to do something when my clients come in. And I am tired at the end of the day. Mostly tired in the way that you might be if you had spent your time riding one of those mechanical bulls at the rodeo. Because so much of my job is following. And following without interrupting and supporting. I really have to be on my game.
Following without interrupting.
Mm-hmm. Yeah.
Okay. That gets my attention.
Okay.
following without interrupting. What kind of things can interrupt? What do interruptions look like, or feel like, or show up as?
Interruptions look like me getting ahead of them and saying, oh, this is where they're going. And I go there first. And it breaks their rhythm. It breaks the harmony. Interruptions look like me arriving at an assessment. It's really easy to do that, right? I mean, because I'm working with the channels and I'm working with the points, and I'm like, oh well, this is this and this, and I just sort of have to let that come up, and it can be part of what leads me to the next place. But if I attach myself to it, I've already interrupted the flow. Does that answer your question?
Well, I think what answers my question is spending more time in clinic with these perspectives and practicing like this. I think that's what answers my question. The guidelines that you just gave me make a lot of sense. I love how my mind works. And I like having a somewhat limber mind that knows stuff. It's very satisfying, right? It's super satisfying. And I don't want to get rid of that.
And you don't have to.
Exactly. So being able to follow where a patient is, you listen to the channel, something comes up. Oh yeah, I think I know something about that. You put your hands on a certain point. I know that point feels like that. Well, I know something about that. Let's get to work. To be able to put my hands on someone, feel the point, watch all the things that I know about that, hold it loosely.
Exactly. So the information that I have, all the studying that I do, because I enjoy reading, it's good to have that there because it informs your understanding of the terrain. So I know that when I am being pulled to a certain area that happens to be following the line of this channel, of this flow, that I know that this point that's lighting up, might be helped if I kind of slide around here and hold this, but it always has to be a question that I'm continually asking.
Mm-hmm. Oh, I love it. Yeah. I love it. So often I will put my hands on people. I will feel something. I'll go, oh, that's the answer. No. Oh, that's the question.
Yes.
Turn the answers into questions. I love having answers. And I imagine my patients want me to have answers. And I like having answers. What if I take my answers and allow them to arise as questions?
Yes. And that goes back to the call and response. Mm-hmm. That's so much, it constantly underlies the work, this constant call and response. That's always what it is. Is this for you? And then you wait for the response. Is this for you? And then you wait for the response.
And when you get the response,
mm-hmm.
How do you know you're getting a response? What is it that you're noticing, or what's arising, or is this too nailed down of a question?
I don't think so. It's movement. It's all movement. Yeah, generally, I'm sure you found this yourself. When someone comes in and they have discomfort, or they have something that isn't working for them the way they would like it to, generally things aren't really moving around that area.
Mm-hmm.
So it's almost I've described it as echolocation. So I send out this little, it's like in space, I send out this little ping and I wait to see what pings back and how it pings back.
Mm-hmm.
Because that gives me an idea of what and where I need to follow.
I love that term echolocation, and I feel like I use that a lot in my work.
Mm.
Difference between how we might be working, at least at this moment, is I'm sending out an echolocation ping that says, is this the answer?
Mm-hmm.
I'm not sending out an echolocation that's more of a question.
Well, and also, I really got this from the brief times I was able to study with Pauline Sasaki, is that in the period of time that it takes you to ask the question, the answer changes. Things change so quickly when you're working with the chi that it's best, by the time you've held on to that answer, it's gone on to being something else. So in her way of practicing, and it made sense to me. So I'd come back to saying, is this the way it is for you? And I mean, is this the way it is for you right in this moment, right now? And then I'm asking about the next moment and the next moment, because it shifts.
That fast. I have been reinvestigating the Teishin needle recently. I've listened to how other people talk about it, and I've got my own, again, investigating it in clinic for myself. I've got this idea that, this is going to take a while to get these tissues to move. But I've also heard people say, no, it can go very quickly. And I have had moments where I feel something flutter under my fingers. I'm like, wait a minute, was that it? Doubting, questioning, rather than, there was a flutter. In this moment, yes, there was a flutter. What about now? Oh, actually, let go of that point now.
It was something that Pauline used to say that I just tickled me. Why are you still on the point? The energy is coming on.
Yeah, exactly. Yeah. It can go that fast. That's helpful to remember.
Yeah, the answers change so quickly, and that's another reason not to. That might be part of what's behind that. I enjoy these discussions we have because I get awarenesses that I didn't have before. Because judgment freezes it in space and time too much. Too much. You can't follow it anymore when you've gotten that. Aha, this is what it is. If you just keep saying, "Is this?" Then you don't get frozen.
Mm-hmm. I've noticed. So I'm going to take and push this like way to the other side for a moment.
Sure.
I think it's germane. It's something that I've noticed over the years, that people come in to see me, or you, all y'all's listening right now, right? People come in, they go, I don't have a diagnosis. Nobody knows what's wrong with me. And so often these people are so thirsty for a diagnosis. They just want to know what it is. I've had patients say to me, I don't care if it's cancer. I just want to know what it is. And that just seems so extraordinarily strange to me. I don't care if it's cancer. I just want to know what it is. And what I recognize, and I see this in my own mind, I think we're back to fixedness. There's this part of the mind, it just wants to know, because if it knows what it is, well, then maybe you can do something about it. But that is so often not the case.
Yeah, and I don't know. I'm a big reader of fantasy and science fiction, and I don't know if you're familiar with Ursula K. Le Guin's work. Okay, so the Farthest Shore.
It's been a long time since I read her work. I was in my early 20s, and I think I read all of it.
Yeah, so you'll remember, though, without the name, Ged or Jed, however you pronounce his name, the idea was that you had to learn the name of the thing.
That's right.
And I think that's what they're looking for, is the name of the thing.
Because then you have magical power over it.
You have power over it.
Then you have the power over it.
Yeah, exactly. Yeah. And I think the answer to that, at least for me, that sense of wanting to be seen, the sense of wanting to have a name, so that you can make some sense and have some power. It's Pauline Sasaki's concept of antipathogenic chi. What Pauline Sasaki was looking for when she scanned the hara was what was right about the person.
Mm-hmm.
What was right. So where is the strength? And I can give that to people. And I like the direction that takes them if they're asking. Because it's really a sense of when you become ill, it's almost like you begin to lose faith in your ability to occupy. the planet. It's like, oh, this isn't working as well as I hoped it would. And it gives you a sense of uncertainty, and like not that uncertainty isn't just a fact of life, but it's like you're standing on shaky ground. And if you give someone a diagnosis of what's wrong with them, that locks them in a way.
Mm-hmm.
It empowers them in that way that they have a name, but it also locks them in to the disharmony. If you can tell them what their strengths are, that kind of leads them out of that. It gives them, it's almost like the lighthouse. Yeah, it's like a lighthouse.
It's like a lighthouse.
Yeah.
Yeah. Well, and it calls them to their strength.
Exactly.
It calls them to their strength. I love that. Usually the diagnosis is about what's wrong with someone. How about, and I want to be very playful with this, how about we diagnose what's right with people?
Yeah.
So I also have read, I think, everything written by Tom Robbins. And one of my favorite lines is something to the effect of, why bother calling in sick? Why not call in well? Sorry, boss, can't make it today. I'm feeling good. Calling in well.
Yes. That's wonderful, because Vernon Smith, who was the owner of the school and one of my first teachers, that's what happened to him. He had a doctor's degree in, I believe it was sociology, and he was, I think he was teaching at LSU. He can get me if I've got the details wrong, but that's what he said he did one day. He just called in well.
Called in well.
He just called in well, and that's when he followed this path. Yeah, I think that's wonderful. Calling in well is awesome.
Calling in well, so we can help our patients to call in well.
Yeah, we can help them call in well.
Call in well. What about crafting a diagnosis that speaks to their strengths and their resources?
But even then, we want to hold that loosely.
Hold that loosely.
And we want to hold it loosely so that they can hold it loosely. I think there's a fluidity to things that's part of health. If you try to stick yourself in a certain place and time, you're already starting to create disharmony, if that makes sense.
Given that we are living in an ever-changing world,
yeah,
such a beautiful concept. It's so poetic. Oh, the Tao. Most of us are fighting tooth and nail against the Tao.
Yeah.
Because just going with the Tao, I mean, like, what kind of eye is going to just go with the Tao?
Yeah.
So there's that too. Yes, holding it loosely, seeing what is right. Again, I like to play with words, and especially after talking with Nick and reading his book and attending some of the geological lives that he and Margot have done, I do this less and less. There's still a part of me that likes to feel like I'm being kind of clever and interested and, come up with some cool stuff. But the coolest stuff is the stuff the patients come up with. If I can just be open enough to hear their brilliance, wow. Yeah, like, don't use my solution, use yours, of course. One of the things I love about acupuncture, it invokes, it calls out something that's already there. It doesn't put anything in, but it can invite other things out. But when I'm being a bit more afferent here, when I'm being a bit more yang than yin, and listening to my patients, there are times they'll say something, they're complaining about it. They'll say, this is something wrong with me, or this needs to be fixed. And I'll listen a little deeper. I sometimes, we'll get a Columbo expression. Remember Columbo? Right? The absent-minded kind of,
yes.
Dopey detective that, oh, wait a minute, but this doesn't make sense. What about this? Right? Sometimes they'll talk about something as being a real problem for them, but I hear it as their superpower. It's like, yeah, I get it that this is causing you trouble, but this sounds like a superpower that you have. Your ability to be meticulous, it's driving everybody in your life crazy, including you, but it's also a superpower. If you need something planned, you're the guy to call. And I love saying that to people. I love reminding them that there is something about you. And yes, it also causes you trouble, but there's something incredible about it at the same time. And I'm not asking them to like give up one to get the other, but to have both be more present.
That is beautiful. Absolutely beautiful. Yes.
And we talk in our Chinese medicine, our East Asian medicine, about the zheng qi, that which is upright and correct. It is a real thing.
Yes, and I think, that the whole, when you're doing that, when you're working with your patients that way, you are doing what in ortho-bionomy we would describe as exaggerating the pattern.
Ah, okay, yeah. This circles us back to earlier in the conversation about taking something and making it just a little bit bigger so it can be noticed.
Yes.
If the air is too still, you feel all the humidity. If you bring a slight breeze in, now it feels different.
Yeah. It's just the presence is important. The recognition is important. That's what we bring, is that recognition. And really, honestly, from the time that we're born, that's what we're all looking for. I mean, the infant, as soon as it can focus, is seeking eye contact.
Mm.
We want to be recognized. Sometimes we forget how to recognize ourselves.
Mm-hmm.
And so, that's what I feel like people pay me for, is to truly recognize them. And to the degree that I do that, I've done a good day's work.
Wonderful. Yeah, that'll give us a chance to sleep well at night, having done a good day's work.
Yeah.
Mm-hmm. Well, my friend, this is probably a good place to put a pin in it. I know that there's plenty more. We may circle back for another walkthrough like this at some point.
Yes, I'd love that. And maybe one through the botanical gardens too.
Yeah, that'd be wonderful.
Yeah, it would.
All right.
Thank
Thanks
you
so much for your time. So often in my work practicing acupuncture, I think of myself as a guide, helping people to connect themselves up with innate but unavailable internal resources. I think about guides as knowing, and because they know, they're trustworthy to be followed. But after this conversation with Karen, all of that gets flipped around. As I consider my work is not to have answers, but to have the capacity to follow patients to their own solution. Navigating the body is one thing. Navigating the body-mind, going slow enough that people can, in moving with their own tempo, find their way out of previously helpful compensations and into a greater sense of ease and embodiment. As I think about it, that goes, well, rather counter to much of how I thought medicine worked. I'm especially appreciative of the perspective I now have about fixing, that in the past I've conflated this with healing or recovery. But the very word itself, to fix, to set down, to nail down, to make firm, to reduce motion, that is actually counter to the flowing processes of nature. I'm curious to take this perspective of following rather than fixing into the clinic and see what happens. Well, I think this is a good place to put a pin in it for today. I hope that you've been enjoying this series on bodywork and East Asian medicine. As much as I enjoy using needles, it is reassuring to be reminded that it's our hands and our attention that are perhaps our greatest asset. Well, here we are at the end of this episode. If you've listened up to this point, you're either a rabid fan of Qiological or the forward button on your podcast player stopped working. If you are indeed a fan of the podcast, you can help us to bring new episodes to our community of practitioners by supporting us with a membership or a one-time contribution. Details, of course, are on the website. That's it for today, friends. Join us again next Tuesday for another thoughtful episode of Qiological.